Hi, my name's Dr. Karina Patel and I'm the Director of the TMJ and Sleep Therapy Centre of London. We're currently based at the London Sleep Centre on Harley Street in the UK. Now, I'm going to talk about the symptoms of sleep-related breathing disorders. Now, they are quite common occurrence at the London Sleep Centre, but what are they? So a sleep breathing disorder is a term for several conditions where partial or complete cessation of breathing occurs during sleep. So there are many symptoms to watch out for, including the most common, like daytime sleepiness or fatigue. Symptoms can also include, but are not limited to, snoring, pauses in breathing described by bed partners, disturbed sleep, and obstructive sleep apnea, which carries many other health consequences, including an increased risk of death. Although these conditions are multifactorial, there are some common associations with weight, neck size, for example, as well as family history and bony and soft tissue structures of the face. So this brings me to many of the clinical signs we as dentists may be able to pick up on general dental examinations. So in a paper written by Dr. Bailey, Dentistry's Role in Sleep Medicine 2010, we can see the clinical observations and their potential relationships to sleep breathing disorders. So if we're looking at the tongue, we can check if it's coated, which might be a risk of gastroesophageal reflux. If it's enlarged, it can mean an increase in tongue activity and possible obstructive sleep apnea. Scalloping at the lateral borders of the tongue also is an increased risk of sleep apnea, and in ENT literature it shows that it can be up to 70% predictive of obstructive sleep apnea. With obstruction of the view of the oropharynx, we look at the Mallampati score, which is essentially how much black space you can see when you ask the patient to open wide at the back of the throat. Now, a Mallampati score of 1 and 2 is a lower risk of OSA, and a Mallampati score of 3 or 4 is an increased risk of OSA. With the teeth and the periodontal structures, we're looking for gingival inflammation, gingival bleeding when probing, dry mouth, gingival recession, tooth wear, and abfraction. Now, this could mean that they have an increased parafunctional activity, such as sleep bruxism, or that they are a mouth breather. With the airway, do they have a long, soft, sloping palate or enlarged, swollen, elongated uvula? These indicate obstructive sleep apnea or snoring. Extraorally, when we're looking at the patient, do they have chapped lips or cracking at the corners of the mouth? This indicates an inability to nose breathe. With mandibular retrognathia, long faces, enlarged masseter muscles, they could be clenching or have sleep bruxism or have chronic mouth breathing. With the nose, we're looking for small nostrils and alar rim collapse or with forced inspiration, which again is a risk of a sleep breathing disorder and difficulty breathing through the nose. And lastly, with posture, we're looking at forward head posture, which could indicate airway compromise and restriction. The loss of lordotic curve in the spine indicates a chronic mouth breather, and posterior rotation of the head, again, a tendency to mouth breathe. So I hope that was helpful. So the key to helping these patients is actually finding those signs and then referral to a sleep physician for testing. So don't be shy, you could be helping to save a life. Thanks for listening.